guys, Leah and Bear here from GSD Bear. Welcome back to the channel. So today we're going to be talking about hydrotherapy, which is what Bear had before and after his total hip replacements, and this is something we get asked about quite a lot, so hopefully you'll find this helpful. So as I mentioned in our last video, having hip dysplasia and a ball and socket joint that don't really align properly, it can make physical activity, even just walking, really quite painful. And because of this, the dogs that have the condition, they're quite lethargic and less willing to exercise. And that in turn means they lose muscle mass, which further impacts the hip issues because it's those muscles that would usually hold everything together. So it's a bit of a vicious circle really. They're in pain, they exercise less. They're in pain, they exercise less, they lose muscle, and then they have even less stability around their hips. So that's where hydrotherapy really comes into its own, and it's not just used to treat hip dysplasia cases, they use it to treat and manage many different conditions. There's two main types of hydrotherapy usually offered, but the benefit of both of them obviously is that the water, it totally takes the weight off their weakened joints so they can exercise normally without putting any pressure or pain on them. So this helps to increase the mobility of their joints, increase the muscle mass, and just their overall fitness over time without causing them pain in the process. So your hydrotherapist will usually give you the option of either full-on swimming, where you'll actively get in the pool with your dog and guide them around and encourage them to swim, or you'll be offered a sort of underwater treadmill, which is what Bear used, where they walk on the belt and the pressure of the water, that is a bit more of a workout for them. Whichever type you go for, they'll tailor the treatment to suit your dog and just gradually increase the amount of time they spend in there. As they get used to it and their health and fitness improves. But you can't just rock up and expect an appointment, you've got to be referred by your vet before you do anything. So when Bear was first doing his hydrotherapy, we had a lot of people ask us on Instagram why he was doing the treadmill rather than swimming in the pool. And the reason for this is that swimming is more of a front limb driven exercise, and the hind legs don't really have that much of a workout in it. It's more of a doggy paddle, which is front limb driven. And of course in Bear's case it was mainly his hind limbs that we needed to build up, and that just made the treadmill ideal for him. So when you first go to a hydrotherapy centre, the first thing they're going to do is assess your dog. They'll probably weigh them and measure their current muscle size, and they want to see what sort of mobility they have already. So they'll want to see how well they can walk, how well they can run, and then after that they'll discuss with you what you want to achieve through your hydrotherapy sessions, and they'll put together sort of a schedule for you. But that really depends on the dog's health problem, and if it's hip dysplasia like Bear, it's going to depend on the severity and the age of your dog. With Bear, I think he was 6 or 7 months old on his first session, and they started him off really slow at first. They let him get used to the harness that he'd be wearing in the tank, and just actually walking through the tank a couple of times until he was comfortable with that. And then they filled the water level up to sort of mid-leg height, and they set the treadmill to the slowest setting to get him used to the idea of it moving. We always took plenty of treats with us for motivation and used that to encourage him to walk forwards, and to be honest, he got the hang of it really quickly. On his first session he was barely in there any time at all, and I think it was something stupid like 2 minutes, and I remember thinking, what's 2 minutes gonna do? But that did gradually increase as the sessions went on, and he went twice a week. So I think by about 2 months into the treatment, he was walking for about 20-25 minutes at a time. And that still doesn't seem like a lot, but because it's exercising them against the pressure of the water, it's more of a workout than a normal walk. I think a 10-minute swim is something like the equivalent of a 1-hour run. So it is a lot of work for the dog. It's like when you're trying to wade through the sea, it's quite difficult, and that's what helps to build up the muscle so much quicker. And that's what he needed, because we were trying to build him up as much as possible, as quickly as possible, so we could get his surgery done sooner rather than later. Also, while he was there, I don't know if this is the same for all places, but at ours they also did other exercises with him while he was in the tank. So sometimes they would turn the belt off so it was completely stationary, and they would just sort of move him side to side, getting him to sway and weight bear on one leg and then the other leg. And also when he was walking, the hydrotherapist would be behind him all the time and have her hands sort of positioned around his hips and his hind legs to try and encourage him to take a larger stride, because he had a tendency to do short strides. And by encouraging him to do a larger stride, it was more of a workout for him, so he was getting more benefit from the session. And this also helped with his range of movement, which was initially quite stiff. And by the end of the couple of months of hydrotherapy he had a lot more mobility. After several sessions, he definitely had built up some extra muscle mass, and that was great. I can't remember exactly how much now, but we had before and after measurements taken, and it had increased quite a bit. And as I mentioned in our last video, this was really important because going into the surgery, it was going to help support his implants when they had been put in place. And also because he was going to lose a lot of muscle mass afterwards from all the cage rest and lack of exercise, I was just going to give him more to start with. After having his hips done, it was several weeks before he could return to his hydrotherapy sessions when they had fully healed. And he went back again to help increase the muscle mass that he had lost from his recovery. He's now finished hydrotherapy, he hasn't been for a long time and he's doing really well. He could still benefit from filling out a little bit more around his hip, but he is so much better than he was at the beginning, and that was, I think, partially thanks to the hydrotherapy, definitely. Before you went, you could feel around his hips and they were very bony. You could feel where the muscles weren't there and it dipped in, but now it's nicely rounded and he's just so much stronger in them, and that is because of all the muscle that he's built up since his operations. The only real cons to this is that it is surprisingly really quite expensive. Like, for the amount of time they spend exercising in there, it does seem like a lot of money, but then again, you are paying for the special facilities and the expertise as hydrotherapists. Luckily, when we went, our insurance covered the treatment, so we were able to claim our money back. And I think back then it was something like £50–55 for a session. But you'll find places that charge cheaper or probably more expensive depending on where you live. An alternative you could try if you don't have any insurance, or maybe if you're on a bit more of a budget, is swimming in a calm body of water. I mean, it's not going to be as good as a proper hydrotherapy session where you're in a controlled environment and they tailor it specifically for your dog, but it could definitely help build them up if you're on a budget, or maybe you just don't have any facilities near where you live. The only real issue with this is that if you do use the river or the sea, obviously the water is going to be a lot colder, especially if you live somewhere like the UK. And this causes the blood vessels in your dog to constrict, which reduces the amount of blood flow to the muscles, so they're not going to work out as efficiently as they would if they were in a heated tank, which is something like 27 degrees C. It's also not going to be as controlled, and you run the risk of overdoing it with your dog, which obviously a hydrotherapist would be there to make sure you can't do. And if you're using hydrotherapy for maybe an older dog with age-related issues like arthritis, then a warm and heated tank is obviously going to be a lot more comfortable for them. The heated element is going to allow them to relax their muscles a lot more, and they're going to be able to take more away from the session than they would in a colder body of water. And I'll leave you with one final tip about hydrotherapy. Don't feed your dog before you go to the appointment. You need to have a couple of hours leading up to your session where they haven't eaten anything. And most importantly, make sure you take them for a toilet walk before they go in, because if they do have an accident in the water, they're going to fine you for it. They have to completely empty the tanks, refill them, sanitize them, cancel the appointments for the rest of that day. It's just not going to be fun for anybody. They never did this, thankfully, but it's just something to be aware of because it does happen and it's going to cost you a lot of money. If you liked this video and you found it helpful, please like, comment and subscribe. We'll be adding more videos about his hip dysplasia and just general recovery, and anything else that you request in the comments below, so do let us know and we'll work it into our next videos. See you next time.